Transferring from bed to wheelchair. Patients with cancer who are weak to go about with their daily living routine may need some help from their caregivers. The caregivers can assist the patients with eating, bathing, dressing, using the toilet, and transferring to a wheelchair or other furniture. In this video, we will be touching on one of the activities of daily living: transferring from bed to wheelchair with moderate assistance. Moderate assistance requires both the caregiver and patient to contribute an equal amount of effort in the transfer. It is important for caregivers to know the correct techniques of transferring so that they can position their bodies well to prevent back injuries. Knowing how to help patients and being able to assist patients correctly would make caring for them less stressful. Step 1. Prepare the wheelchair. Remove the armrest closest to the bed. Ensure that the leg rests are out of the way. Remove or swing away the leg rests, depending on the wheelchair's configuration, to prevent the patient or caregiver from tripping during the transfer. Step 2. Turning in bed. Using simple and clear instructions, let the patient know what you will be doing when performing the action. In this case, the patient bends the right knee to turn left. With your right hand holding on the patient's opposite shoulder, right shoulder, and left hand holding on to the patient's opposite hip, right hip, turn the patient towards her left. Step 3. Sitting up. Gently lower the patient's legs off the side of the bed with your left hand while supporting her right shoulder blade with your right hand. Place your left hand on the patient's right hip and your right hand on her left shoulder blade to bring the patient to a sitting position. Patient may assist by pushing her left hand down on the bed to sit up. Do let her rest for a moment if she is feeling dizzy. Have the patient lean forward. Shuffle her body towards you so her feet are flat on the floor. Step 4. Transferring from bed to wheelchair. Position the wheelchair close to the patient at a 30 to 45 degree angle with the brakes properly locked. Ensure patient's feet are well positioned on the floor. Place your hands on patient's upper body. Lean patient forward before lifting the patient and turning the patient towards the wheelchair. During the turning, gently lower the patient into the wheelchair. Shuffle patient's body into the back of the wheelchair and place her in a comfortable position. Avoid having the patient put her arms around your neck or grab you, as this may result in both of you falling. Adjust the armrest and footrests back into their positions. Position the patient's feet on the footrests. Overall, wheelchairs with removable armrests and swing-away leg rests are more versatile and ideal should patients need more assistance in transfers. Tips for transferring. Before moving the patient, it is important to pay attention to these points. 1. Visualize in your mind how the move is going to be carried out. 2. Understand the constraints of the patient's environment, as each scenario and patient's condition may be different. 3. Ensure that the wheelchair and/or bed are properly locked when in use and their brakes are in good working condition. 4. Always inform the patient of what you will be doing and work at patient's pace to avoid any sudden movements. 5. Check to see if the patient is in any pain. 6. Always stay close to the patient so that you will be able to react if anything happens. The transfer from bed to wheelchair with moderate assistance can be done more easily when the instructions are followed closely. Remember that you are not in this alone. Reach out for help and surround yourself with the right knowledge and support. CanHope's professional allied health team is available to help and care for you and your loved ones.